I think that this was a very important phase 2 randomized trial comparing a newer triplet with a second generation PI, so Carfilzomib instead of bortezomib, with Lenalidomide and Dex, plus or minus transplant with Carfilzomib Cyclodex. So the final conclusion for sure are that the combination of PI and IMiD is winning, so this is an important concept, so because this I think it is becoming the standard of care for newly diagnosed transplant-eligible patients. We also showed that the addition of transplant is particularly useful in high-risk patients. So for standard risk, maybe the triplet is enough because the rate of MRD negativity can be achieved the same. But for patients at high risk of early relapse, the addition of transplant is worthy. So this is another important message that in particular in high-risk patients, upfront autologous stem cell transplantation is remaining a standard of care. We also showed the results in high-risk patients in different subtype of high risk, showing that with this combination it's possible to achieve a high rate of MRD negativity. And we know that for high-risk patients especially, the goal is really MRD negativity, and if you are not achieving MRD negativity, you may be pushed to a quick change of treatment, for example. So this is important, and the trial demonstrated this. And of course, in the end, we had the result in terms of progression-free survival. For the overall survival is a little bit too early. So I think that, Carfilzomib Lendex can really be considered a standard, a good treatment, not standard because, well, it is not as approved in several countries, but can be considered a good treatment for high-risk patients especially.